Yes, hi again. I am Rachel Cooper, and I'm with the Center for Public Policy Priorities, and I am speaking in favor of all three bills because they all get to the same point, which is to improve the administration of the SNAP program, to allow it to do what it's supposed to do, which is to help the lowest income among us to afford a basic diet and avoid hunger when money's tight. There are some other people here who will speak more eloquently than me about what the drug felon ban does in the day-to-day life of a family, but I did want to point out a few things that the way the SNAP program is administered, the benefits are loaded onto the Lone Star card, and it can only be used to purchase food and has very strict fraud controls. It's considered to be one of the best run programs in the federal government. When you talked about why this ban came about, it's been in place since the 1996 welfare reform, and the original content behind it was to control fraud issues, which have been solved in large part by moving away from paper food stamp receipts to an EBT card. The state has a vested interest in seeing that all felons, including those convicted of a drug crime, successfully reintegrate. And SNAP can be a very useful tool in accomplishing that goal because it helps provide access to the most basic of necessities, which is food. It helps the newly released be able to get back on their feet, and as we all know, those are folks who have the hardest time finding employment and reestablishing their lives. The current policy places unnecessary stress on families. The way the program works, a child can get benefits even if their parent cannot because they have a former conviction, which literally means that for a family, a parent who comes back home to a family recently released would be taking food out of their mouths of their children if they were to eat. So that puts stress on that family and could lead to reoffending. And a recent small study that came out showed that some 90% of recently released drug felons suffer from food insecurity, and the ones who had the greatest issues were the most likely to reoffend. We really think that these bills help Texas to join the 41 other states who have seen that pulling people out of the cycle of crime and poverty is only helped by allowing folks to access SNAP and to help them get through. The work sanction piece of the bills and of 587 and on 1072 we're also speaking in favor of, because for the same very specific issue is that, SNAP is there to help the lowest income folks. We know that Texas is, the way it's run in Texas, recipients with children over 6 must work at least 30 hours a week or participate in SNAP employment and training through the Texas Workforce Commission, depending on which county they live in. And yet, Texas is only one of 3 states in the country who denies the entire household their SNAP benefits if the head of household is unable to secure that 30 hours, which we know many low-wage workers in today's economy have trouble getting full employment. Many are stuck at part-time work for no reason, and that's where their employers have felt like that way they don't have to pay benefits. So even when they're trying, they may not be able to make it, and to cut off the benefits to the entire family doesn't advance the state's interests of promoting work. It only contributes to the state's already horrendously high rate of food insecurity amongst children. So we ask that you support these bills to remove the full family sanction and to lift the drug felony ban. Thank
Members, any questions? Witness? Thank you so much for your patience.
Hello again. So I'm Rachel Cooper with the Center for Public Policy Priorities, and I want to testify on all of these bills for the same basic reason. We strongly believe that being able to worry about what you eat is a luxury. For the 4 million Texans who depend on SNAP, their first concern is if they'll eat. While SNAP is literally a lifeline for millions, ensuring them access to a basic diet at an average of $4 a day, which is roughly the price of a pound of grapes, it doesn't go very far. It's unrealistic to expect someone who's worried about how they're going to stretch $4 into 3 meals to be highly worried and focused on the nutritional content of what they're eating. They just need to eat. That's why we are in support of HB 3434 and the committee substitute for HB 948, because we believe that both of these bills acknowledge the fact that healthy eating is more expensive, and they both encourage ways to explore and increasing the buying power of SNAP recipients, but with incentives, and to promote the purchase of healthy eating and through advertising. We are in opposition to HB 523, 571, and 1101 because we believe they do not improve the programs. They don't promote healthy eating, but put up unnecessary and often unworkable barriers to using SNAP. They force SNAP recipients to be treated differently than all other shoppers, and they assume that people who use SNAP make poorer food choices than everyone else, which there's no evidence of. We are members of the Partnership for a Healthy Texas, and we are huge advocates for ways to improve the health and nutrition of all Texans, especially the low-income Texans. But we believe that the best way to get there is to help get people food stable first, and that is the goal of SNAP. And we're concerned that any bill that restricts those options and what people can buy and treats them differently gets in the way of that and undermines our first intent, which is to make sure no one goes hungry in this state. Thank you.